Good afternoon, everyone. Delighted to be here this afternoon to say a little bit more on our strategy for the next 5 years and for something a little different from what we've talked about so far with Anna and Maura. I'd like to say a little bit about our thoughts on health research and data infrastructures. And I suppose I'm going to start and run pretty quickly through an area that you probably think about most when you think about the HUB and infrastructural support, and that is, of course, an area of long-standing and significant now investment over the last decade or so, where we have invested in facilities on the campuses of hospitals for the conduct of trials and intervention studies, support services, clinical trials networks, methodology support, funding for trials, etc., etc. Over 100 million over the course of the last decade or so. And you'll know that we published a report with a deep dive review of that collective investment in 2018 that had a number of recommendations in that for taking that one step further. And it therefore won't come as a surprise that you know that in this strategy we'll continue to invest in this space. Indeed, the next 3 to 6 months, a number of calls have closed and applications are in on our desk currently, and we have some strategic choices that we will need to make in relation to that. But clearly we want to increase the volume of trials, both commercial, and we want to see growth in our investigator-led trials, the diversity of trials, the quality and the efficiency of trials, and ultimately the impact for patients of this trial infrastructure in the country, and importantly increasing our international reputation and on the international stage, where we can readily compete in collaborative multi-centre trials. So what are the types of things that we're looking at in that regard in relation to our trials infrastructure? Well, I mentioned strategic choices, and I suppose it won't come as any surprise if we want to move gradually on our journey to those metrics of more diversity, better quality of trials and so on. We'll be looking for initiatives and centres and networks that are ambitious to our common goals, can perform well across a new metrics framework that we are developing with the advice of a strategic advisory board to the HRB. So that's an important development. We're increasingly looking for stakeholder commitment, both from the clinical, the academic and commercial partners into this endeavour, including co-investment and cost sharing, but not limited to that. And I suppose we're looking for applications which are future oriented, as well as doing the work before us today. So those who are looking around corners, who are already thinking ahead in terms of potential funding streams in Europe through the new EU for Health Partnership, linking into EU platform trials, thinking about value-based healthcare and the merging of real-world data with clinical trial data, thinking about trials in intervention studies out into the community, thinking about cell and gene-based therapies and the whole move to advanced therapeutics. What does that mean for our clinical trials infrastructure, our capacity building for our future? And ultimately, in a small country, entities that can deliver in their own right for their own institutions and for their own areas, but fundamentally can be integrated and coordinated strategically and operationally to ensure that the sum of the parts is greater than those individual parts. The second area that I want to touch on today is again one where you can see the discourse and the dialogue in Ireland growing. And it really builds on recent decades of transformation that we've had as a result of OMICS, advanced machine learning, high performance computing, the move to cloud computing, really sophisticated imaging methods and so on, and all the opportunities on the one hand that throws up for prevention, diagnosis, treatment and care, but of course the complexities and the challenges of trying mine all of that information from many sources and actually turn it into actionable knowledge. So really exciting area, an area that the HRB has been increasingly getting involved in, these international alliances and consortia to try and navigate this space. For example, the IC PERMED, the HRB is participating in that. We're involved in the EJP in rare diseases. We're linked in already, obviously, with ECRIN in S3, but we're looking at other research infrastructures like Elixir and like EATRIS and BBMRI in that regard. And we're observers currently on the 1 Million Genomes project that Lisa Maria mentioned earlier. And I suppose really a job of work for us in this strategy is to figure out the so what for Ireland and so what for the HRB. What and where should we as a HRB community and the HRB itself, working with the Department of Health, because the interface between the academic and the clinical system is absolutely critical here. Where can we add most value? And we also know that there are other partners in Ireland like SFI, IDA, NEI who are very interested in precision medicine as they call it, and what can we do together? Is there an intersectoral vision or a strategy, and can each of us play a part in terms of taking us forward there? And I think we have a critical role to play as a community where we are in that space between the health policy, the health delivery and the academic systems, and with a very significant public, patient and citizen engagement footprint. And I think that is going to be important, because before I move off this point, I suppose there is a tendency for people to think of those who are in OMICS and informaticians and computer scientists and so on, and the infrastructure and the platforms around this. But it's also important for our wider grant holder community, because issues come up here in terms of, like I said, what does it mean for clinical trial design and compliance with GCP? Data, again, optimal collection and use of health data, absolutely significant here. Health economists and social scientists will have questions arising from this in terms of equity, in terms of transparency, in terms of inclusion of the patient voice in this dialogue. And it also throws up lots of issues that we really haven't grappled with in any sort of meaningful or sophisticated way in this country, around the role between the public sector and the private sector. So we do need to get into discussions around new business models and so on. So I think a lot in there of interest to our broad-based community. The third and final issue that I just want to say a little bit about, I couldn't resist it. I just want to follow along the lines that Lisa Maria presented to us earlier, and selfishly, that's a large part of the reason why we really asked her to participate in this Grant Holders Conference, because we just see this as being absolutely a huge and critical area that is optimising the use of health and social care data for research purposes. And I'm not going to labour the point, because you'll have seen a version of this in Lisa Maria's slide, but we have to find a way of securely and safely and transparently accessing this data and for many secondary uses, not limited to, but we are looking for it to be accessible for research and innovation purpose. This is just increasingly critical. You've seen it in the discussion on trials. You've seen it in the discussion on OMICS. If you're a health services researcher, you're limited by access to sort of patient level details for workforce data, for claims data, for pharmacy data. If you're a population health researcher, you really want to look at geospatial data, data from wearable devices, survey data, registry data, etc., etc. So this is absolutely critical, and this really is where we believe we need an Ireland vision for how we're going to take this forward. We're clear that the HRB can't take this forward alone. However, we have a lot to offer in this space. We've previously published a vision, the DAZZLE model, a number of years back, for data access, sharing and linkage. And we've taken that one step further, and we've actually got a proof of concept study underway at the moment with iCheck, looking at the technical architecture and interoperability issues, and showing the art of the possible, albeit with dummy data. On the back of this and building, I suppose, on the needs through COVID, we're soon to launch a mechanism in partnership with the CSO and the department to provide access to the COVID-19 data hub for research purposes. You'll hear a little bit about that in the next number of weeks and a lot more detail. And we just think this is a huge step and a flagship project for a potential way forward. We've also learned a lot from our prior experiences of secondary data analysis projects that we've funded, even without these mechanisms, and we really want to do more in this space. We've leaned into a lot of really, really timely, critical initiatives in a European context. We're participating with the department in a PIRI for COVID, which is a population health infrastructure, looking at sharing of population health data into the future and an infrastructure to do that in a safe way. And we've been involved in discussions around fair data and open data more generally. You'll be very familiar with our involvement in that. And we know that other countries have done this, like FinData, like the Estonians, like the French Data Hub, and so on, across the UK. And we're really excited to be participating in this new initiative, started on the 1st of February, towards a European health data space, which is really Europe's way of saying, this is where we're moving. And you're with us or you're not with us. So I'm delighted to say that we are working alongside the department and hopefully others in due course on this initiative. And what does that mean? Well, it means that we'll be learning, harnessing the collective learning and the wisdom of people who have been there, who have done that. And yes, that group is looking at how to share these data and so on across Europe. But we've so much to learn in terms of how we can get our act together nationally in order to play in this arena, whether it be architecture and portals, whether it be governance and access rules, training needs for both the providers and the users, regulatory frameworks, a huge programme of work going on to look at harmonisation of the interpretation across Europe and a code of conduct for sharing of data. And of course, no conversation in this area would be complete without talking about citizen engagement, participation and data altruism. So this will give us a way forward. There will be no excuse. It's like dazzle to the power of 1,000 by way of information and evidence and a way forward. And so the challenge is to harness all of that, connect us and you into that as much as possible, and to try and influence our national agenda. Our health information system strategy, long overdue, hopefully will be prioritised in the Department of Health's work in the year ahead. We have a public service data strategy, which is quite interesting and could be a catalyst to support some of this work, and I think it is important. We haven't typically spoken between the R&I sector and deeper in the past. I think we need to do that. And we have an opportunity to influence the agendas of both the refresh of Innovation 2020, the new government department with responsibility for innovation, science and higher education. We have a national development plan where something really, really meaningful could be done and be a step change for this space in this country if many parties are to come together. So I think I hope I've convinced you that these are actually very interconnected areas throughout our strategy. Really important that we play a leadership role in brokering with the department, with other government partners, and that we bring you on that journey. And we will need you all the way on that journey to enact a new future for data, for health research in Ireland. Looking forward to the discussion and to questions later on. Thank you.